Even though it is aimed to provide a completely painless experience, every individual has their own way of experiencing pain and tolerance level. With anesthesia and modern hair transplant techniques, however, pain can be taken under control for the most part. 95% of our patients feel so comfortable that they can sleep during the operation. Hair transplant operations are generally performed under local anesthesia. This anesthesia takes its effect by temporarily numbing nerves in the transplant area. In this way, the experience of pain is prevented during the process. Our expert will give you more detailed information before and during the operation. A series of medical evaluations and tests are made before hair transplant operations. The purpose of these tests is to evaluate the general health of the patient and determine their suitability for the operation. These are the common tests that are made before hair transplant operations. Blood tests for transmissible diseases. Additionally, EKG test is generally requested for older patients and with patients with heart disease history to evaluate their heart rate and electrical activity. Medical history and examination. Our experts will ask you questions about your general health and evaluate your medical history. Additionally, special hair transplant examinations can be made to determine the hair structure and nature of hair loss. These tests and evaluations are important to find out potential risks and determine the suitability of the patient for the operation. Other than these tests, our expert will give you detailed information about preparation instructions and necessities. The duration of the operation can change depending on the number of grafts transplanted, size of the bald area, the technique used, and the experience of the experts in the team. Generally, hair transplant operations take between 4 to 8 hours. With large-scale and more complex operations, it might take longer than 8 hours. The duration of the operation might change depending on these factors. The number of grafts. The number of grafts to be transplanted is one of the biggest factors that determine the duration of the operation. The number of grafts to be transplanted might change depending on the degree of hair loss and hair restoration goals of the patient. The techniques used. There are different methods in hair transplantation operations. Among these are FUE Sapphire and DHI techniques. Operations with the DHI technique generally take longer because individual grafts need to be put into the COI pen and transplanted into the area. The staff and experience. The staff carrying out the operation and their experience levels might also affect the duration of operations. A more experienced and better trained team can carry out the operation in a shorter amount of time. Anatolia Hair Clinic is at your service with its focus on patient satisfaction and team of experts with 99% success rate. Hair transplantation is accepted as an operation that is carried out within 1 day, and patients are generally allowed to go back home the same day. When the patient will be discharged depends on the complexity of the operation, the number of grafts transplanted, and general health level of the patient. Experts might request you to stay for a few hours after the operation to monitor potential risks and discharge you afterwards if they see fit. After hair transplantation, it is important that you follow the instructions given before returning home. These instructions give information on potential complication symptoms, how to wash your hair, how to change your bandages, and they support the healing process. It is important to follow these instructions to minimize infection risk and optimize your healing process. When you have any questions or concerns after the operation, you should immediately consult your clinic.